Yes, it's square. It is square. Thank you. It's sharper. It got sharper.
Make sure you can see.
Okay, so start now. So we just finished here. Now we're going to continue. As I mentioned before, the lateral meridian, which starts on the front of the face, thank you, comes in two parallel lines and through the sacrum, and now it continues through the gluteals, through the hamstrings, through the gastrocs, out the side of the foot. So we're going to do a few things here for the hip, hamstrings, and gastroc. So first of all, we're just going to start and just opening up here. One of the things is that the head of the greater trochanter of the femur, it provides a nice point to place your palm of your hand in, and to come in and just lean in with this perpendicular pressure to start to stretch the lower back, and also the upper fibers of gluteus medius, which are just directly distal or below the iliac crest. So that provides a nice natural handle to lean in.
I'm going to go around you and be over here.
Okay.
Yep.
And then again, like before when we were making ourselves familiar with the bony landmarks, I always like to call attention for myself to see where the bony landmarks are, because the meridian, subos, and the muscles obviously are in between the bony landmarks. So here we're dealing with the lateral border of the sacrum. So I like to just make sure I know where that is. And the aforementioned greater trochanter of the femur. So we're going to be working all in this area, starting just above the table here to get into tensor fascia lata, and then just coming right into the gluteus. So because of the surface, I choose to use the flat of my fist a little bit just for some general loosening through an extended arm and a stance where I can shift my weight. Then I'm going to include the leg as a lever. So I'm going to rotate the leg a little bit. As I mentioned, that every technique is a form of diagnosis. So just by moving the leg, you get a sense of the mobilization, or the mobility rather, of the hip joint to see if there's any overt tightness here. So this is actually pretty good. Coming out like this, it's usually about 40 to 45 degree angle for good thing. That means everything okay. Abductor-wise here, also pretty good. So I'm going to use this mobilization to bring the leg across the midline. It brings the musculature, it brings the meridian, it brings subo up to the surface a little bit more so that you can engage more readily. Pressure okay?
Yes.
Not too much?
No.
So lean in this time and pull back. Difference?
Yes.
Add resistance to the movement of the hip out. I come up. Knee. Not too much? So leaning in. So here, nice supported position. So I can lean in. And it's up to you, like what feels better. You might want to do inside leg. One way, and then press, pull back. Loosening of the hamstrings. So here's the gluteal fold. And one thing about addressing the hamstrings, if you know where the common point of attachment is, which is just immediately onto and distal of the ischial tuberosity, there's a lovely acupressure point immediately there that helps facilitate the movement of chi down and out. So when you start with compression of the hamstrings, I would recommend coming up and placing just distal to the crease and sinking in. So here you're right over, so you're hard right over the work, and you can just sink in and exhale. Pressure okay?
Yep.
And I would recommend this leg because every movement now it opens your body up to the movement. If you do this, I'm not going to do that because it crosses your body and it just throws you out of balance. So there's this standard compression here where you can compress, and then easier compression as you get to the point of attachment behind the knee. But also there's compression and pin and stretch, right? So you're pinning the hamstring and stretching. Okay?
Yes.
Okay, so this is another way of working the hip, because in this froth position, this figure 4, it stretches the adductors more and it helps the dynamic here of the hip. And here it gives you opportunity to sit down again, if you like. And you can use your forearm to come in. So I use this lock position so the leg can't slip. And I just simply, like we're working the lamina groove of the back, we can sink right in here. And the gluteals have a attachment to the lateral border of the sacrum. So my pressure is coming in a 45-degree angle right into the lateral border of the sacrum. So you're really having some sustained pressure right at the point of attachment there. Pressure's okay?
Good.
Not too much?
No.
Do you want it to be too much?
Take a bite.
So I'm just going to work this whole area. Forearm. So when I'm working the attachment of the sacrum, I'm sinking in towards the sacrum at a 45-degree angle. When I want to get the belly of the muscle in between the lateral border of the sacrum and the greater trochanter, I'm going to sink straight down. That gets the belly. And then, if you remember from your anatomy, below the gluteals are the 6 deep lateral rotators, piriformis being one of them. And they emanate like a spoke from the center of a wheel out like this. So they have attachments all in and around the greater trochanter of the femur. So as we approach the attachment of the gluteals here and the belly of not only the gluteals but the deep lateral rotators here, if you address the contour of the head of the femur of the greater trochanter, the greater trochanter of the femur, you can get the attachments of the deep lateral rotators. So again, knowing the location of your bony landmarks here, and then sinking down, and then this time coming in like this so that your pressure is going right into the greater trochanter of the femur. And that gets right at the attachment. Okay? Her voice went up an octave, I think. So you noticed that, yeah? But those 3 passes can be very specific to the attachments and the belly. So it's a very thorough approach to the musculature.
Is there any consideration with someone with a hip replacement or a knee replacement?
Sure, absolutely, as there should be. It's like how long they've had it, how they're acclimated to it, as far as the movement. And more or less, I probably wouldn't do this figure 4 position. I would have more of a supported neutral position just to increase some range of motion and make sure that the musculature that is supporting the hip gets opened up, because it'll just increase the blood supply, which is what you want. I used to work on somebody with a hip and knee replacement, not the same person, and I would just always keep it in a nice neutral position, even though sometimes they would say, "Oh no, fine." I didn't really feel that comfortable doing it. I was more focused on strengthening the muscles around it as opposed to getting some openness around the
Low
joint.
battery.
Pardon?
Low battery, it says here.
Oh, I thought you were talking about me personally.
No, 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 no. Low battery.
Okay. Is it still,
Does it still?
is there a low battery mode?
I don't know if you can record on low battery mode.
Oh, okay. I will hurry then. So you think about the totality of this. So lateral meridian coming
Thank you.
through, and then here on the side, in this position, you have the iliotibial band, the gallbladder meridian. So in this position, it's easy to take some nice pressure leaning in. In floor work, I stand and use the arch of my foot to come right into the contour here. It really is nice. And also, too, if you're working on someone, even on the table, and you want to get into the hip in this position, pressure's okay?
Yeah.
So you want to come right in between these bony landmarks. And you want to make sure that you're in a supported position so you don't feel like, even when you're shifting your weight, you're in danger of going in too much. You want it to be a controlled position. You can put one knee down like this and do this, but it feels a little awkward to me coming that way. Okay. So, nice controlled movement from Hara. And then you can, and so here, 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 and what's left is anterior, which is psoas. So in this position, so it's from this position, you just come above the iliac crest and just shift your weight. So it's a nice triangle movement. You know, the psoas is interesting. It's the only muscle that attaches the top to the bottom. So, you know, that might be too much, and you might just want to do this. So you can keep a more sustained stretch and not labor so much with it. And this sustained stretch will help open up the anterior pelvic area also. And just to finish off, coming in the back of the knee, never a good idea to put a lot of direct pressure into the popliteal fold or crease, but it also is where the two lines of the bladder meridian come together. So there's this really lovely point called meeting in the middle, or standing mountain, and I like to address that with a little pressure. And then the bladder continues right between the gastroc heads, and it gets fascially bound quite a bit here in between the gastroc heads, so coming in with a braced thumb and just sinking in that lower portion of bladder meridian, you can see how the muscle splits to the side when you're right in the middle. And the meridian itself comes down, and where you start to feel the natural continuation of the muscle as it continues as tendon. Here, the Achilles tendon, as it attaches to the calcaneus, it starts veering lateral, and it comes in between the Achilles tendon and the lateral malleolus, right in this groove, and it comes right onto the side of the foot, and right at the base of the fifth metatarsal, there's a lovely little acupressure point for balancing the bladder meridian. You let me know if you feel a dull ache, please.
Just sit right there.
Okay. And then right out the little toe. Then I like to end with a little grounding of the bottom of the foot. The partner of bladder is kidney, And the kidney meridian starts on the bottom of the foot. It also helps invigorate the energy to go up into the body, because we just worked it all coming down, and now you start sending the energy up. Kidney 1 on the bottom of the foot is called bubbling spring. It's a very invigorating point. So I'm just coming in, shifting my weight. Okay, and then out. Push button.
This one.